Good evening and welcome to our 43rd season of Doctors on Call. I'm Dr. Ray Christensen, a faculty member at the Department of Family Medicine and Biobehavioral Health at the University of Minnesota Medical School, Duluth. I'm also a family doc at Gateway Family Health Clinic in Moose Lake. I'm your host for our season premiere tonight on upper and lower airway and respiratory illnesses, RSV, COVID, flu, pneumonia. This season we will again be rotating hosts from the medical school, which will include Dr. Mary Owen and Dr. Peter Nalen and myself. The success of this program is very dependent on you, the viewer. So please call in your questions tonight or send them ahead of time to our email address, ask@wdse.org. The telephone numbers can be found at the bottom of your screen. Our panelists this evening include Dr. Ken Ripp, a family medicine physician with CMH Rader Family Clinic in Cloquet. Dr. Stephen Schumacher, a family medicine physician at Essentia Health, Hermantown, and Dr. Ryan Harden, a family physician at the Gateway Family Health Clinic in Sandstone, also a faculty member at the medical school in Duluth. Our medical students answering the phones tonight are Riley Berg from Bemidji, Minnesota, Will Stone from Melrose, Minnesota, and Wyatt Windhorst from Alexandria, Minnesota. And now on to tonight's program on upper and lower respiratory illnesses, RSV, COVID, flu, and pneumonia. It's interesting when you see the respiratory illnesses, they talk about upper and lower, and I think we need to differentiate between because they don't get treated all the same. So Ryan, what is meant by an upper respiratory illness?
So that's a good question. Upper respiratory infection is any infection from the nostrils into the nasopharynx, into the pharynx, which is behind the nostrils and behind the mouth, down into the larynx where your voice box is, and down into the trachea. That's the upper respiratory or upper airway. The lower airway or lower respiratory infections affect the lung tissue itself and the major airways into the lungs, the bronchi and bronchioles. So anything above the lungs is considered upper airway.
Steve, is there a difference in the way we treat those?
Well, it all depends upon what is causing the infection, I guess. And so primarily, like if it's a viral infection, there are some antivirals that are being approved mostly for influenza and COVID now. And then if it's a bacterial cause, then obviously antibiotics would be the best treatment. But it's kind of differentiating what's causing the infection.
It seems like there's more of a tendency to try to stay away from the antibiotics. Most of these are viral, I believe, aren't they?
Yeah.
Ken, what do you think?
Yeah, the vast majority of the common cold that we all get during the winter months they're viral in nature, and sometimes you have a virus long enough, you can get a bacteria on top of that, but that usually takes weeks of being sick. And so we try and be, judicious in our use of antibiotics and really try and figure out who really needs antibiotics because we're trying to make sure that they're effective when we need them.
What are some good treatments for upper respiratory infections? Any one of you can jump in on that.
That would depend on if it's a bacterial infection or a viral infection. Most upper respiratory infections are viruses. And
I'm thinking symptomatic treatments.
Staying well hydrated, taking some acetaminophen, getting plenty of rest, eating a healthy diet.
Robitussin sometimes is a good one to go
Yeah,
to.
that's been good for 50 years.
Yeah.
Mucinex, Robitussin DM. Honey as a cough suppressant has good data. Vicks has good data as a decongestant. And then the if you want to go behind the counter one, you have to ask the pharmacist. Sudafed is a potent decongestant. And you can use, if you're really congested and looking for just a little relief, a nasal decongestant can be used, but that needs to be used only for a brief period of time, a few days, because if not, it can cause more problems.
What kind of symptoms show a change from a viral and a simple infection to one that you should be concerned about? And we can get into pneumonias and other things here, but what kind of changes, I'm an old guy, what would I go through that would get me concerned?
I would say is if you...
You can beat me up now.
Right. Now, if you have a common, you're going through the usual common cold, which would be a sore throat followed by nasal congestion followed by a cough. And if you're getting better and have a sudden worsening, and you have a redevelopment of fever, fatigue, shortness of breath, and a change in your mucus, that could be a sign. That's definitely a sign to go get checked out, because that may be, we call a bacterial superinfection. So,
Any other thoughts on that?
Uh,
Cough maybe changed?
based on your symptoms. So like if you're getting a lot of dizziness, a lot of lightheadedness, or you're feeling like more what we call like orthostatic, where you're feeling like that you're generally like just worsening instead of improving, like Dr. Ripp said. Those would be reasons why I think we want to make sure, and especially if you're immunocompromised or based on what medications you're taking, we might have like a lower threshold just to make sure that it's not something more serious, basically.
Other symptoms that somebody might be developing a pneumonia secondary to an upper respiratory viral infection would be also if they're having a more productive cough, if they're coughing up blood, or if they have low oxygen sats, or if they, when they take a deep breath, if they have chest pain with deep inspiration.
When should, so you've got a child, let's go to children real brief because the question came in. When should you take a child to the office for a checkup with an upper respiratory infection? How do I know it's not just a cold?
Well, speaking, well, we're all family practice doctors here, but and
You can
taking
speak
care-
for us.
Oh, great. Okay, thank you. So taking care of like infants primarily under 2 months, like we want to know about it. So we don't, if like a baby is febrile or anything 100.4, we want to know about it basically. So that's the reason why. But
Yep.
yeah.
Things that I wouldn't really worry about with kids so much is if they're playful, if they're, if they're still interactive, if they're enjoying their playtime with their friends and stuff like that. If they have a little bit of a cough, runny nose, maybe low-grade fever, temp 99 and stuff like that, they're eating and drinking well, I'm not too worried. But if they start to be lethargic, if they aren't eating and drinking appropriately, if they develop a rash or a high fever greater than like 101.5, then I would be more concerned that they should probably be evaluated in the clinic.
So let's move into COVID. It's still out there, I believe. And as I heard the numbers, there's several, I forgot the numbers, like 100,000 or whatever, so many dying each day in the United States from COVID. So that's still there. The shot, should people get the shot?
Yes.
yes.
Yeah,
Okay.
everybody over age 6 months.
Yep.
So now we're coming into this blast 'em kind of thing. I'm starting to feel like a little kid now, where you go to the doctor's office and you get 10 shots. So I'm old, and all of a sudden there's RSV, there's flu, and now there's COVID also.
Pneumonia shot. Don't forget your pneumonia shot.
Well, how good is, well, one at a time. How long is a pneumonia shot good for?
Well, if you're over 65,
So-
the two pneumonia shots. So if you have the RSV is a once in a lifetime, and the Prevnar 20 is a once in a lifetime shot. So you're done.
That's what they said about the other.
Well, but so far that's been held true, and so we'll wait. And the reason why we got to the Prevnar 20, as I explained to my patients, is, the first shots were so good that they made a sequel because it was that successful. And for those of us who are practicing in the hospital, from when we've trained to when we become attendings, we just don't admit patients with pneumonia like we used to. I mean, I remember that was like every second or third admission was someone with pneumonia. And we just don't see that anymore because we are curing it or preventing it or making people not get sick enough to require hospitalization. You can still get pneumonia, but you won't be in an ICU or, God forbid, die. So,
Steve, additional comments on that one?
Yeah, I mean, I guess like with the majority of my older population, then I would say definitely above like age 65. Like I'm highly recommending them to get immunized against with the PCV 20 pneumonia 20-valent pneumonia vaccine. I think it's a little less contentious compared to, I don't know if this is true or not, but it seems a little less contentious. People are more willing to get the pneumonia vaccine compared to other viral vaccines. It's not saying that they're any less important than the pneumonia vaccine, but it seems to be like a little bit more, they're more willing to get that done at least. So maybe it's just that they realize how serious pneumonia can be, but flu and COVID are both equally, can be serious, so.
and right now in parts of the United States there's a big outbreak of pertussis. and they said it's been one of the
Hold
highest.
on to that for a minute.
Oh, okay.
The one other thing I want to do before we jump off flu, as long as we were there a little bit, but I want to come back to pertussis. Ryan, why is the over 65 different than the under 65 flu shot? What's that all about?
Well, the
Seeing as how I care now.
the flu shot that we give to people over age 65 is a higher dose of the antigen that provokes an immune response, because as we all get older, our immune response diminishes. So you want to give a higher dose of the antigen so you get a more robust response from somebody's immune system. It's also recommended that some people with chronic illnesses under age 65 get the high dose vaccine. And I'll add to the pneumonia vaccine, everybody should have the pneumonia vaccine at age 65, but some people under age 65, people who smoke, people who have asthma, COPD, chronic lung disease, people who have heart disease, they should be getting the pneumonia vaccine under age 65.
So, okay, then let's go on now. The other one is RSV. So what's our combined knowledge on RSV? I think last year was the first year, if I remember right, that we really pushed it. And it's being pushed again now as a fall shot, correct?
So RSV, I mean,
Yeah, just-
historically was a disease that we worry about more in kids, because little tiny humans have little tiny airways, and when they get inflammation in their airways, it can actually interfere with oxygen exchange. As people get older, they get larger, their airways get larger. RSV, the virus, respiratory syncytial virus, doesn't tend to affect the lungs as much unless people have chronic disease in their lungs like COPD, asthma. But we are now vaccinating everybody. It's recommended that everybody over age 75 get the RSV vaccine, because again, as we get older, your immune response changes, and RSV infections in older people can be very serious.
So a couple of months ago, I finally got caught with COVID. So when do you get your COVID shot after you had COVID? So there's questions here. People that have recently had COVID, do they wait a while, or can they go ahead and get them now, or what's the story?
You can go ahead and get them anytime after COVID. Immediately after COVID, you probably do have an elevated protection against it for a while, but you don't know what type you had, and so if you came across a different variant of it, you could get COVID again. Hopefully your body would have some memory, but I tell people you can probably wait a month or two and then get the shot.
Steve? I saw you had an answer there.
Well, no, I generally agree with that too. And I mean, like unofficially, like we've always said, like maybe like 90 days or something. I find that if I can convince people to be like, okay, well, if you'll get your flu shot now and then I'll get you your COVID shot in 90 days, then at least you'll follow up for that. And then it's a way to like get people to make sure that they're following up for their vaccines. So.
And just as we leave RSV, one shot, it's not one and done. It's every year, correct? RSV?
I believe so. I thought so. I don't know. One and done.
I think that
We'll figure it out.
that story is still evolving.
Right.
I think we don't really know yet. But your immunity after the RSV vaccine wanes more quickly than it does with like the pneumonia vaccine.
Right.
So Jim from Hibbing would like an honest answer from all three of you. Are you in favor of the COVID shot this year?
Absolutely.
Already had mine.
I'm going to have mine.
There you go, Jim.
Yeah.
Are we seeing increased heart damage from viral infections? And the person that's asking is from here in Duluth, specifically RSV and COVID. And where are we with some of the long COVID, if you want to venture? And I'm not calling on each of you, just jump into this. It's kind of a discussion.
Well, many viruses can infect the heart and cause something called myocarditis, which can be very significant, serious condition. There was some data originally when younger males would get the COVID vaccine that they would develop a myocarditis from the vaccine, but the incidence of myocarditis from the COVID infection was much higher. So it's not common to have a viral infection affect the heart, but when it does, it can be serious, and that's why we try to get people vaccinated against those viruses so they can't be exposed to the live virus, which can move into the heart.
Have any of you dealt with the loss of smell with COVID with patients? And are there any treatments for that?
Yes and yes. So it is one of the most frustrating parts of getting over COVID is if your sense of taste doesn't return, because it makes eating difficult and uncomfortable and unpleasant. It takes one of the enjoyments of life away. There are things you can do. There's different odors that you can smell to try and stimulate your nasal passages to start to get those nerves going again. And they can actually go in and do a block. Certain of the interventional pain people will go in and actually block some of the nerves that will stimulate it, and that's been found to be helpful for some people. I have had patients who've had success with that block.
And I think we're still trying to get a feel for the long COVID. You know, we did bring it up, and I'm not sure just exactly where that's going and what percentage of people that get COVID get long COVID. And I sometimes wonder if we overread that sometimes too as we see patients.
It's a book yet to be written, because we're still learning about it, and I think that the effect of once a virus clears your body does not mean that it hasn't left a scar behind on the body. I use polio. So people who had polio and then years later develop post-polio syndrome, it's not that they have polio again, but that virus that affected them early on is coming back to wreak some havoc. Now, unlike shingles, you get chickenpox as a kid or get exposed to the chickenpox virus when you're young, and then when you're older you get a rash, which can be devastating for people. They don't, that is a virus, that's sort of a second life of it.
So that kind of leads us into zoster.
Mm-hmm.
Talk about the herpes zoster shot, Zostavax. What's your feelings on that?
Well, it's Shingrix now.
It's Shingrix.
Shingrix,
Yes.
yes.
What was it before?
Zostavax.
Zostavax.
Yeah.
See, you can tell
Age
age.
yourself there.
Sorry.
But yes, Shingrix.
So everyone over age 50, we recommend getting, it's a 2-dose series basically, and then I think it's 4 months apart. So best way to prevent either A, getting shingles, or B, having severe shingles that could be permanently disabling. So people can have postherpetic neuralgia, we call it, which is nerve sensitivity that can affect them for years after having shingles. So.
And a question that comes up in my practice a lot: if I've had shingles, do I need the shingles vaccine?
Yes.
Yes. Yes is the answer.
I knew that answer. So.
It took us a long time to figure that one out, though.
Yeah.
Just thinking back over the years. Just to finish off COVID, I thought I was going to do that before, but how often do they need a shot? And basically, that just kind of comes up government or whoever CDC puts these together.
Right.
So
Again, I think that story is, we're still learning.
looks like yearly, don't it?
I think it's
I
probably
believe it
gonna
will
be
be.
yearly going
Yeah.
forward,
Yeah.
if we had to predict.
Did they last year have it separate? They came out with a new vaccine towards the end of when they started offering, and so then that was kind of split. But I believe.
I cut you off on diphtheria. What was
Pertussis.
Pertussis, yeah,
so,
not
so,
diphtheria.
so pertussis, is one of the other vaccines that I'm a big fan of is that they I don't know how many years ago they allowed us to continue to give the tetanus shot with pertussis in it. We give that to kids, and then for a while we're just giving adults just the tetanus shot. They add the pertussis back in to try and prevent adults from getting pertussis. And so right now there's a big outbreak, and they're blaming it on two things. They're blaming it on decreased vaccination rates, and then some other factors. But they have had 2 deaths, and so if you haven't had your tetanus shot, you should consider making sure that's up to date.
We're dealing with measles coming back too.
We're dealing with measles in certain parts of the country, thankfully not so much in Minnesota. Did they have like 1 case down in the cities or 2
cities, yeah.
cases?
Yeah.
So we in Minnesota are very fortunate, and we have high vaccination rates. And one of the things that we talk about in medicine is we talk about herd immunity. So if you go in and you vaccinate 80 or 90% of a population, the whole population gets the protection, because a virus that gets in can't move around at all. And a prime example was they had a case of measles hit New York and California at the same time. And in New York, it went nowhere because the vaccination rates in New York City are very high. But in California, where the rates had gone down for numerous reasons, it spread, and they had a big outbreak and a big problem.
Big problems. How likely is it to get Guillain-Barré from vaccines? It's a question that's been around for a long time. I don't personally have an answer. I think that the question is there. And I don't know, do you fellas any insight?
It would be rare, and I bet you none of us have seen it vaccine caused. We've seen Guillain-Barré, but I've seen it twice, not related to vaccinations.
I've seen it twice and not related to vaccines.
I think the correlation between Guillain-Barré and vaccines is strongest with the flu vaccine, but there was some preliminary data that it was associated with the RSV vaccine, but that has, that's been debunked.
Is vitamin C helpful? Respiratory infections?
It's not going to hurt, but I don't think like mega dosing on vitamin C is necessarily going to help you out any more than just having a glass of orange juice a day, unless you have diabetes. But never mind. Yeah, I mean, I think like just make sure like you're getting like 100% of the vitamin C. So mega dosing on any vitamin, I don't really recommend to people, but
Good health, good diet,
yeah.
no smoking.
Yes.
Hydration.
Oh, yeah.
Hydration.
Yeah,
It's so great.
Yeah, we haven't mentioned that yet. Yes,
Yeah, it's just great that
that's
it's
a
not
way
there.
to get over your upper respiratory infection.
So we talked about the viral infections. How do you get a bacterial infection, lower or upper respiratory?
Well, I mean, you get exposed to the bacteria. You can contract a bacterial upper respiratory or lower respiratory infection like a pneumonia the same way you contract a viral infection. But usually what happens is people will get a viral infection that'll suppress their immune system, and then they'll start to get better, and their immune system is suppressed, and then bacteria will move into their lungs and cause a secondary infection. And those can be quite serious.
The other question that comes up is autism and vaccines. I don't have any personal knowledge except that I'm not sure that there's a correlation between vaccination and autism, but you're the experts.
The link has been quite clearly proven not to exist. If you go into countries where they don't vaccinate or don't have access to vaccines, the rates are the same. There has been an increased rate of autism in the United States without a doubt, but to blame it on one thing like vaccines is not, there's not the data there. There's so many other environmental changes, the change in our food sources and what's in our food. So we've not been able to link to say what has caused this change. But vaccines is not it.
Yeah, the other thing that I've been told is that, that I've been taught is that we're identifying autism more, basically. Like it's just that it's been there, and then now we're kind of putting a label on it, basically. And so then it happened at the same time that we started being like, okay, we're going to start vaccinating against all these preventative illnesses. Both things, like it's a correlation, not causation, basically. Just.
I think you hit on, Steve, you hit on something that's important across society, because it's not just autism. We have a lot more practitioners. We have a lot of newer knowledge, and so on. So we're making diagnoses that we hadn't been making much before.
Right.
Or we've also changed maybe some of the criteria for some of those diagnoses too. If someone had mild chickenpox around 10 years old, do they need a vaccination?
If you are sure that you had chickenpox, then technically you do not. You can safely receive the vaccine, and it's probably safe because then you will get a more complete protection against, and the people who gets vaccinated have actually more protection against shingles later on.
But you should still get the shingles vaccine even if you had the chickenpox when you were younger.
Right.
So.
And if there's any question if somebody had chickenpox, you can do an antibody titer to see if they have antibodies. If they do, then they probably had chickenpox.
A quick, this is bad, you're going to throw me out. Somebody, just a quickie on pulmonary fibrosis.
Ooh. Well, that's for another show. No, so pulmonary fibrosis is it can.
But
be
it makes them susceptible to a lot of stuff.
What pulmonary fibrosis is
You have 1 minute.
A gradual stiffening of the lungs over time, and so lungs are not able to move air across. It can be a rapidly progressive disease that leads to death. Those people, if they get any infection, can be tragic. So vaccinations can be critical to keep them healthy and try and preserve their lung function as long as they can, because that is a tough one.
And the other place, I guess, would be the respiratory infections. The COPDs and the asthmas
Yep.
and all of the rest. I want to thank our panelists, Dr. Ken Ripp, Dr. Stephen Schumacher, and Dr. Ryan Harden, and our medical student volunteers, Riley Berg, Will Stone, and Wyatt Windhorst, for their help and assistance tonight. Please join Dr. Mary Owen next week for a program on women's health and female cancers, when our panelists will be Dr. Michael Cassing, Dr. Sandy Stover, and Dr. Addie Vittorio. Thank you so much for watching, and panel, thank you so much for some great interchange. This is fun. Thank you.